Hello, it's Dr. Gay from First Look MRI, and this is a 41-year-old male presented with knee pain, nonspecific pain, no trauma. And on this MRI, we see that there is a large or a moderate to large joint diffusion with these funny streaks of low signal within, kind of bizarre looking. If we come back here, we can see that there is some fluid in the gastrocnemius semimembranosus bursa, but it's very complex. It looks like the synovium is thickened. It's really indistinct. It's hard to tell where the fluid is in the thickened synovium and around the periphery. Also maybe some leaking of fluid here back along the medial gastrocnemius muscle. Kind of just a funny look to it. This is a cystic erosion here. The ACL is diffusely thickened, and there's this erosion of the intercondylar notch adjacent to that. A little mound of something in there, a little gray tissue within that bone cyst. Also over here we can see the popliteus tendon. Usually it looks normal, but here it looks too thick and too gray. So we're going to look at that on another view here. Let's put up a sagittal view. In our sagittal view, we see several things. One of them is this cystic erosion here, funny looking thickened ACL. And if we go over here to the side, we see this faint marrow edema. This is along the lateral femoral condyle. So if we put up the coronal view to look at that, we see that ACL is thick. We see that cystic erosion there with a little funny area of intermediate signal within it. And we see this gray fluid, this synovial inflammation out here in the lateral side, and this looks like it scallops the lateral aspect here. So it looks like a chronic bone erosion, and this funny process here that's eroding chronically here, causing that faint marrow edema, little bony spur down here. So the main finding here that gives us away, it looks like, is this chronic erosion, and it's right around this popliteus tendon. So the popliteus tendon wraps around here laterally. We can see this gray thing right here is the popliteus is really thick, and again in front of that and associated with that there's this area of brightness, which is synovial thickening or synovial inflammation. This is the iliotibial band displaced outwards over here, and again with the combination of the thickened popliteus and that synovial inflammation, that chronic erosion, this is very classic for gouty arthritis. So, interesting case of suspected gouty arthritis, and thank you very much.